This video is brought to you by the Anesthesiology and Pain Medicine Department at Seattle Children's Hospital. We hope that after watching this video, you feel better prepared and understand more about your child's upcoming procedure. In this video, we will cover before the procedure, the day of the procedure, and anesthesia and sedation. Before the procedure. Let us know about fever, runny nose, cough, and any other changes in health or medications. Please tell the nurse that will call you before the procedure, as well as the anesthesiologist doctor on the day of the procedure. Changes in health may increase the risk of the procedure or anesthesia. For example, if your child has a cold, cough, or runny nose, even if symptoms stopped recently, your child may have wheezing, vocal cord irritation, or need more oxygen during or after the procedure. To avoid these breathing problems, the procedure may be canceled and rescheduled. In some cases, we may still do the procedure, but need to know about these health changes. Your anesthesiologist will decide on the final plan with you. Your child will need to stop eating and drinking before the procedure. This is because under anesthesia, the stomach muscles relax and food can come up and into your child's lungs. This is called aspiration and can cause breathing problems. For your child's safety, their stomach should be empty. A nurse will call you and give you the exact times to stop. Follow these exact times to avoid cancellation of the procedure. Make sure all family members are aware. Day of the procedure. What happens when you arrive at the hospital? You will check in. A pager or phone will be given to you. We bring you and your child to the pre-procedure area. Who is my child's care team? First, a certified nursing assistant and pre-procedure nurse will assess your child. Next, the anesthesiology team, surgeon, and procedure nurse. The anesthesiology team includes a doctor called an anesthesiologist, and sometimes a doctor in training called a resident or fellow, and a nurse anesthetist or CRNA. This team is always supervised by the anesthesiologist doctor. Your child may also have a child life specialist, an interpreter if you speak a language other than English, are deaf, or hard of hearing, cultural navigators that help families understand medical care better, and social workers. All team members introduce themselves and wear name badges. Be sure to ask any questions or tell us about any needs you may have. When can I see my child again? When the procedure is finished, you will be contacted on the pager or phone provided to speak with the surgeon or procedure doctor. The anesthesiologist will bring your child either to the recovery room, also called the PACU, or if more care is needed, to the ICU. PACU stands for Post-Anesthesia Care Unit, and ICU stands for Intensive Care Unit. A nurse watches your child closely as they wake up. As soon as your child is ready, you will be contacted on the pager or phone. You can ask for updates anytime at the surgery center desk. Anesthesia and sedation. How does the anesthesiology team take care of my child? Our main goal is to ensure your child's safety and comfort. The anesthesiology team will always be with your child. We monitor your child's blood pressure, heart rate, breathing, oxygen, and pain the entire time. We respond quickly in any way needed for your child during the procedure. Let us know about any concerns or past experiences your child or family has had with anesthesia or pain. What types of anesthesia are provided? Anesthesia means giving medicine to treat pain and making your child less aware during a procedure. We offer general anesthesia, regional anesthesia, and moderate sedation. General anesthesia is most commonly used. Your child will be fully asleep and comfortable and wake up only after the procedure is done. Because the throat muscles relax, doctors typically place a breathing device to keep the airway open. Let us know about loose teeth. We do not want to move them. For select patients, we consider regional anesthesia. Numbing medicine is placed around a nerve to block feeling pain to the specific part of their body, depending on where the procedure area is. To block feeling in the belly, chest, or legs, medicine is given in the back, called an epidural. To block feeling in just one area, such as an arm or leg, medicine is given only here, called a peripheral nerve block. Your child may get one dose of numbing medicine that lasts for many hours, or through a tube or catheter that lasts for many days. These nerve blocks are usually done after a sleep. Moderate sedation means giving medicine to feel calm. This is for select procedures or illnesses. Your child may feel drowsy or light sleep, but not fully asleep. They may hear or respond when the doctor speaks to them. Your anesthesiologist will decide on the safest plan with you. How does my child fall asleep? There are two main ways, a mask or IV. With a mask, your child breathes in sleep medicine and oxygen. The anesthesiologist places the mask over your child's nose and mouth. This mask stays on until they are fully asleep. During this time, it is normal for children to wriggle, have noisy breathing, or roll their eyes. It may look strange to you, but it is normal, and the anesthesiology team is helping them. Another way is an IV, a small tube placed in your child's vein. Your child falls asleep almost immediately. We choose this for older children if your child already has an IV, or if we feel it is safer to do so due to medical conditions or urgency of the procedure. Your anesthesiologist will decide on the safest plan with you. What if my child needs more support to fall asleep? If they are anxious, we offer pre-medication such as midazolam, also called Versed, can help your child feel calm before going into the procedure room. It can be given by mouth, by IV, a nose spray, or if needed, by injection. A child life specialist can work with your child to explain what they are going to experience, like how to take medications, show the anesthesia mask, offer distraction techniques such as games and electronic tablets. Parental presence for some children, depending on your child's age or developmental needs. If watching your child fall asleep is stressful to you, there are other ways we can help, such as pre-medication, child life or distraction techniques. Please let us know. If we feel it is safer due to your child's illness or an urgent procedure, we may not invite you into the operating room. Your anesthesiologist will decide on the safest plan with you. What if my child is in pain after the procedure? Please speak up at any time. Tell us how your child is doing or what coping strategies work best. We assess with a pain scale and give pain medications by IV or sometimes by mouth. Medicines like Tylenol or ibuprofen may be given. Sometimes stronger medicines are needed, like morphine or hydromorphone, also called Dilaudid. For some procedures, your child may get a PCA button to push, or patient control analgesia. This gives an exact amount of pain medicine through their IV. For some procedures, regional anesthesia or numbing medicine may be given. Please review the section what types of anesthesia are provided. How do we care for your child in the recovery room? PACU. We monitor your child closely as they wake up from anesthesia, such as breathing and blood pressure, and respond in any way needed. We treat pain. Please review the section, what if my child is in pain after the procedure? Nausea or vomiting, confusion. They may kick, scream, or not recognize caregivers. This is called emergence agitation. We can give calming medicine, but it will resolve over time on its own. When safe, we give your child something to eat or drink. How can caregivers help? You can watch this video. Talk to your child about their procedure and anesthesia. Come with questions. Speak up at any time during your hospital visit. Ask for an interpreter at any time. Thank you for watching this video. Please reach out to your team if you have any questions. Here are more resources. We look forward to seeing you.